Hello everyone. I just hope that everyone's doing well and taking precautions. And I will be beginning my presentation, but first of all, I wanted to introduce you to my audience. Alright. And today, I will be talking about the disease I was doing research for. My disease that I was in charge of was Histoplasma Capsulatum. Okay, so Histoplasma capsulatum is a species of a fungi. It is found throughout the world and mostly found in the eastern part of the United States along the Ohio River Valley, but also prevalent in Africa and South America. This agent is gram-positive and affects many humans every year. This disease is mostly found in dirt, soils that contain high levels of nitrogen, and fecal matters from bats and birds. Okay, so this disease, this fungi, loves to be in a 25-degree Celsius temperature, and it persists of tiny round spores of mycelium. The entry site for the fungus is mainly through the respiratory system. Spores of this parasite can become airborne and inhaled by humans when the soil is moved around by humans or the wind. So if you're digging up a hole or moving the dirt around, raking leaves, anything, it can become airborne and go into the air, and then someone would inhale it. An individual may experience respiratory symptoms such as dry coughing, painful breathing, chest pain. If the infection is more severe, a person may have fever, sweating at night, and loss of appetite, which may lead to weight loss. About 7% of patients develop histoplasmosis, which comes in 4 different types of ways. Let's see if this works here. Okay. The first way that the disease may appear and develop in an individual is by ocular histoplasmosis. In this case, the reaction occurs in the eye. You can tell that it starts in the eye by the redness and the inflammation of the eye. These spores can spread from the lungs to the eye, and that's how that happens. That's one way, the first way. The second way the disease may appear is by chronic cutaneous histoplasmosis. In this case, the reaction of the histoplasmosis occurs in skin lesions and ulcers. In the ulcers, and the infection works its way up to the respiratory system. Most of the symptoms from this type of way of receiving the disease may be similar to tuberculosis. The third way that the disease may appear and develop in an individual is by systemic histoplasmosis. In this case, the histoplasmosis is found mostly in the lungs. It shows up in the patient, and which in this type of way, the liver and the spleen could enlarge, which can lead to severe consequences or even death. The last way, the fourth way, that the disease may appear and develop in the individual is by chronic pulmonary histoplasmosis. In this case, the individual has severe dry coughing, blood sputum, nightly sweating, loss of appetite, and because of the loss of appetite, it results in weight loss. Diagnosis. The diagnosis of this fungi is done from several tests and observations from the healthcare providers. Histoplasmosis is based on the identification of budding yeast in the lungs. This test is done by scraping the skin, cerebral spinal fluids, checking the sputum, and samples from various tissues. The diagnosis is confirmed by the presence of the dimorphism found in the testing culture samples. The culture samples you can see spiny spores and round spiny spores in the culture. Symptoms for the Histoplasma capsulatum may come and go between periods of time. Sometimes it depends on how healthy the individual is. If you're healthy, you're able to sustain and also prevent the disease. Symptoms of the histoplasmosis may disappear without treatment in some people, and others may need treatment to manage the infection. Some of the medications, so these medications are only taken if the disease becomes very severe. Most of the time, they will not give you medication because it's your body is able to fight against it, especially if you're healthy. Ways to prevent the disease. There really isn't a way to prevent the disease other than maintain good hygiene and stay away from people that could potentially be carrying the disease itself. It is very difficult not to take in air that could be contaminated with this fungus. Messing with another way you can prevent was messing with materials that are near bird droppings, exploring caves, cleaning houses. Like, prevent of doing that unless you really need to. Although you can control what happens if you have these symptoms, or what happens if you have the disease, like you know that you have the disease, you can control that. So by a way of controlling that is that you can go to the hospital and get treated. And that's it. Thank you very much.